Good evening, all. Today we'll be discussing about cardiology topic, that is how to prevent heart attack. So I just wanted to send out some messages to the community so that together we can reduce the incidence of heart disease in the community. Before going into the topic proper, uh, let's see why I'm talking about heart disease. Not only because I'm a heart cardiologist, but basically because the heart disease is the commonest cause of death worldwide. So that is applicable to everywhere, everywhere, even in India, even in Kerala. It is the commonest cause of death, and it adds to a lot of morbidity on top of mortality. So we need to contain this disease urgently. So if you see, as doctors, we are continuously working on this disease to prevent the disease by giving medicines when the patients are coming to our hospital. When the patients are coming with heart attack, we are treating them. If we are doing only that, all the hospitals will be overwhelmed by cardiac patients because the prevention, the actual prevention, it's not happening. So today I'm stressing more on how to prevent the disease than on how to treat the disease. So it's my duty and the duty of all the cardiologists and doctors out there to prevent the diseases in the society. So that's why we are discussing about prevention of heart disease. If you are taking heart disease altogether, we have so many kinds of heart diseases, like congenital heart disease, which is happening in young children, then valvular heart diseases, pericardial diseases. So many types of diseases are there. But altogether, the commonest heart disease is coronary artery disease or heart attack related diseases. So I'll be talking more on the prevention of heart attack and how we can save our health and prevent a sudden premature death. So it's a serious topic, and I'll talk about around 10 to 15 minutes about these points. And if you have any questions, you can type the questions in the comment box. So, before starting this, I need to give an idea. What is heart attack and what is block? Both these two are not the same. So, heart is pumping blood to all the organs of the body, and the first organ which is getting the blood from heart is heart itself. So heart has got three main vessels supplying the blood to the heart. And if you have block inside these vessels because of atherosclerosis, basically cholesterol plaques, the disease is called heart disease or coronary artery disease. If it is only block, it is a milder variation. And if it is going into heart attack, it's an emergency. So in heart attack, what happens is that the block is blocked and some disruption of that block is happening and the blood is getting clogged in the blood vessels. And whatever flow which was happening previously, even if it was low, it is completely or partially obstructing suddenly. It happens in a sudden way. Whereas in block, it is happening over a period of months and years. So slow reduction of blood flow is happening in a heart block. Why do people get heart blocks? There are so many causes of heart block, but I'm not elaborating all the causes, but important ones you should know. And if when we are seeing patients at a younger age with heart attack, what we see is that the most important thing is family history. If the patient has got a family member like a father, mother, uncle, or brother who have a heart attack in when they are in the younger age, like 40 to 50 years, the chance of this person getting the heart attack in an early age is very high. So such patients should not take the coming advices from me because The treatment of such people are entirely different compared to other people who don't have a family history. So a person having a family history, they should go to a cardiologist and say that such and such persons in my family is having heart attack. Here I am with you. I want to prevent a heart attack. What should I do? Then this doctor can evaluate him properly and give advices so that he can avoid a premature heart attack to some extent, not 100%, to some extent. Then second most costing problem that is happening in young adults who is having heart attack is smoking. So smoking is a very high risk factor. If you say in smoking adds to around 6 times risk to a person compared to non-smoker. So 6 times risk is added. Apart from smoking and family history, other causes include diabetes. Diabetes it affects heart over the long run. For example, over a period of 10 to 15 years, diabetes will be affecting almost all the organs of the body, including kidney, heart, eye, nerves, all those things. In that way, it can uh, cause heart attack also. Second is hyperlipidemia or excess cholesterol. It is a risk factor. Third will be hypertension, excess blood pressure, which is not controlled. And fourth and fifth you can count as obesity as well as lack of exercise, especially along with improper food, junk foods, and all these things. So, if you ask someone from the society what is the commonest cause of heart attack or why the heart attack is coming excess, their first answer will be food and lack of exercise. But they are not sensitized towards the importance of family history, importance of smoking, and the other things like the importance of control of diabetes and lipids. So these are the commonest causes of heart attack. So how do you prevent it? So for that, we need to divide these people, all the public, into two groups. One, those who do not have a heart disease at present. Second group, those who already have a heart disease. So those do not have heart disease is having sometimes they'll be having risk factors. Sometimes they don't have any risk factors. The risk factors include smoking, diabetes, hyperlipidemia, and hypertension. Then lack of exercise and junk foods and all those. So if you have a risk factor, you have to change it. How? If the person is having um, hyperlipidemia, all the hyperlipidemias need not be treated by medicines. So sometimes you can start exercise, control your food, then the hyperlipidemia can be controlled. So how much is the control required for you? It depends on a lot of other factors. It's not a fixed value. It's not same for all. For example, if a person with family history of heart disease is having lipidemia, hyperlipidemia, we will treat it aggressively with statins, medicines. Whereas a person who don't have any family history, don't have any other risk factors, but a minimal elevation of the lipids are there, we will give him time to control the lipids by food control as well as exercise and all those things. So it's different. It's better to consult a doctor before deciding your treatment. And the same way, this person should have a control of diabetes. The control of diabetes can be done in any way. Like if you can control your blood sugar by just by exercise and food control, well, that's good. Adding some medicine, good. You in sometimes some people may need insulins. It's okay. But once your blood sugar is controlled, the risk factors are less. So the ultimate point in diabetes management is not to reduce the amount of insulin or not to reduce the number of tablets, but it is the control of diabetes. If you are taking 4 medicines or 5 medicines and still the blood sugar is not controlled, you still have the risk factors for all the complications of diabetes. So control of diabetes is very important. What is a good control means? For example, fasting blood sugar. if it is less than 150, and 2 hour or 1.5 hours postprandial blood sugar if it is less than 200, and an HbA1c average below 7.5, and better if it is less than 7. It's a very acceptable kind of blood sugar control. So that should be maintained. Lipids, I told it's not a simple value or single value for a person. It depends on a lot of other factors. But in total, we are looking at the LDL level as well as the total cholesterol level. And a person with higher risk, the LDL should be less than 70. A medium kind of risk, it should be less than 100. A diabetic patient should have a statin to prevent the heart attack. And third one, the lipidem, the hypertension, blood pressure. If you ask 100 persons, do you have hypertension? They will say no, you don't have. The next question you should ask is, when is the last time that you checked your blood pressure? Sometimes it will be years back. So what they are thinking that they don't have hypertension. So hypertension is a disease which will not have any symptoms in most of the patients. So if you want to detect it, you should check your blood pressure. So check your blood pressure regularly. If you are identifying hypertension, then start treatment according to the doctor's advice. And regarding smoking, cessation is required. A reduction in the number of smokes is not enough. And cessation itself, once you cease, you stop smoking, it will take around 2 years for you to reach the level of a non-smoker. So cessation is a must. It may take time, but it is a must. And another important point is that if a diabetic person is smoking, the risk is multiplied. For example, diabetes adds to risk around 2.5 to 3 times. So his risk is 2 times. Let us take 2 times. And the risk by smoking is 6 times. So the risk of a diabetic smoker will be 12 times the non-smoker, non-diabetic person. So it's very high. So all these risk factors are compounding into the patient's total risk. And regarding exercise, how much should be a normal, a good exercise? Because there were a lot of controversies regarding excess of exercise is damaging, and excess strenuous exercise should be avoided because it can cause heart diseases, heart attack, cardiac arrest, and all those things. So there is a confusion, and even some people started saying that exercise is not good for your health. So there are so many confusions happening there. A good exercise should be around 20 minutes, uh, 15 to 20 minutes of vigorous exercise. Max, you can go up to 30 minutes. So it should not be beyond 1 hour. We should restrict it within 1 hour. And what should be it's a vigorous exercise. And possibly, if you can do it on at least 150 minutes a week. That means 30 minutes into 5 days, it's 150 minutes. Or if you are going for 20 minutes, it should be little more, 6 or 7 days you can work. So 150 minutes of exercise, vigorous exercise per week is enough. And what about what about our food habits? The food habits is basically we need to reduce the saturated fat. We are better to avoid junk food, all those things. So people used to ask me whether it is necessary for a normal person to avoid all the fat, all the good foods that are available. No, it's not necessary. But the trend is important. If you are balancing your food, and sometimes if you are taking some biryani or something for a lunch, then you can compensate in the evening, and so that it should be a balance. So altogether, there should be a control over food. A food control in the prevention of heart disease has got a moderate effect. The best effect is by all these first 5 points that I have told. So that's about prevention in a person who don't have a heart disease. Then second person who has had a heart attack or who is detected to have a block by angiogram. Then this person, on top of the all the activities that we have discussed, this person is supposed to take aspirin and a good amount of statin to reduce his cholesterol, LDL cholesterol to below 70. So that is an additional point. And depending on his status of the heart, like its pumping capacity, its the number of blocks, any persisting blocks, all those things, he should titrate his exercise accordingly. A person who don't have any good capacity of the heart should not try to exercise like a normal person. He will end up in trouble. And his food also will be dictated by his personal conditions. Like sometimes we may ask them to restrict sodium also, restrict fluid intake. So all those things depends on the person's heart's uh, capacity. Sometimes it may have destroyed by the previous heart attack. So for one thing is sure, all those activities suggested for a non-heart disease patient should be maintained. On top of that, he should maintain his prescribed medicines continuously lifelong. So that is an additional point. And second part of prevention is how, to better prevent the disease, we need to detect it very early. If you are delaying the detection of the heart disease, then that can cause a problem. So an annual checkup or once in 2 weeks, 2 years, if you are checking your heart healthiness by consulting a doctor, it's actually nice and should be done when after around 40 years or so. So it will help to detect the disease early, and we can act upon it before it ends up in a heart attack or a cardiac arrest. And most of the points I have told about prevention of heart disease. First is heart disease prevention for a person who don't have a heart disease, existing heart disease. Then the risk factors like family history, smoking, diabetes, hypertension, hyperlipidemia, excess food, and lack of exercise. This should be addressed. Second part, we already having heart disease patient. It depends on the capacity of the heart. They have to titrate it, and the medicine should be continued lifelong. So that is the message I wanted. Then third point that I highlighted is the early detection of the disease. The disease per se may not be detected early, so sometimes it will get detected only when the patient goes for a major heart attack. So there are ways with which we can detect this disease earlier, so that we can treat it properly. And now going to some of the myths that is happening in our society. So I got some suggestions from my friends. They wanted me to discuss some of the points. So one doubt they used to ask is taking statins will have damaging side effects. It's a wrong notion. Statins are one of the most safe or safest medicines available in the world, and one of the most researched medicines in the world, with millions of people participating in the trials of statins. And for your information, I'm also taking statin. So it's a reassurance I hope to you. I'm also taking statin. So if you have an indication to take a statin, do take statin. It will help us. Second question is cardiac arrest and heart attack are the same? No. Heart attack means the blood flow to the heart is suddenly stopped, and some part of the heart is not getting adequate blood. So the muscles of that side of the heart is getting damaged. So that is heart attack. And cardiac arrest means with some of the reasons, maybe because of heart attack or some other reason, the heart is stopping. It's not pumping. Suddenly it stops. If the heart stops pumping, what will happen? All the blood supply to the entire organs will get stopped. Then the brain will lose its function. The patient becomes unconscious. Within a few minutes, the patient will die. So that is called cardiac arrest. So cardiac arrest is a dire emergency. Heart attack is also an emergency. Cardiac arrest, the patient is unconscious. Heart attack, the patient is conscious. And cardiac arrest, if not treated within few minutes, patient will die. Heart attack, as such, will not cause death. Heart attack can lead to cardiac arrest, which can cause death. So heart attack also should be treated early. Then another myth is that they are saying that heart disease is completely preventable. and the heart disease is caused by poor lifestyle. So slim and active people are protected. It's a wrong notion because some of the slim and active people will have a strong family history, and without having any other bad habits or risk factors, these people can have an early heart attack and even cardiac arrest. So family history is very important. Smoking should be avoided. I used to tell them some of the people to improve their health, they are cycling, they are exercising. After the exercise, they go for smoking. It's useless. So smoking should be avoided. Family history, people, for people with family history should people with family history should be they should be uh, taking care of their health in a different way than the other people. So I think with this, I think I can stop. If there are any other questions, I am ready to take. Is there any way to detect a heart attack early? Yes. So, for example, a person with heart attack is almost always with symptoms. It's because it is happening suddenly. So if the patient is having a symptom like chest pain or angina, then we can go to hospital. We'll sometimes even the first ECG will be showing signs of heart attack, or an echo will help, or in doubt the patient should undergo an angiogram to detect heart attack. I think the question was supposed to be, is there any way to detect heart disease early or block early? In that one, sometimes if the patient is having a higher risk, or if the patient want to check their health, a treadmill test will help. And some of the newer techniques without angiogram also can help to detect the heart blocks early. Earlier, that means before ending up in a heart attack. So the importance, there was one more question. I have heard that processed meat is not good for heart health. Is it true? Yes, it's true. Processed meat is not that good for health, heart health, because it is saturated and it will be having more salt also. So it is better to have fresh meat, and that too with lesser red meat. And heart disease and heart attack, it's not just a medical problem. It is a social problem because heart attack is happening in people, most commonly in males, at an age of 45 to 65 years, where they have struggled their early adulthood, they got a job, they are building a family, married, having kids. Kids will be having schools and their marriage, their job, all those struggles will happen. At that peak of their life, suddenly, without any invitation, without any warning, this heart attack is happening. And some of the families will not be having good financial strength, and the treatment will be costly. Sometimes it may end up the demise of the family member. So everything gets affected. The family gets shattered with a single heart attack. So heart attack is not just a medical problem; it's a social problem. And in US, years back, they were having increase in heart attack year by year by year, and they started working together. All the citizens, not just doctors, all the citizens of US, with massive campaigns, with the involvement of the media and the government activities to prevent heart diseases, helping them to get more exercise, getting good preventive heart care, all those things. Together, they could achieve a reduction in the incidence of heart disease. It's not just because of the introduction of big corporate hospitals or big government hospitals. It is the preventive activities which helped to reduce the incidence of heart disease. So, if US, America can do, from India, we should do that. The same thing. Now, the headquarters for diabetes, the headquarters for obesity, the headquarters for heart disease is India, our country. and we don't have the resources to contain this deadly disease. So we should act now to prevent childhood obesity, to improve our health, to early detect and to avoid bad habits, and to uh, take care of our personal health, our family's health, and the health of our society. So, with this message, I'm planning to stop this. Manisha, since summer is here, could the heat affect my heart health? What should I do? Usually, heat is not mm, directly related to heart, but if people are taking medicines for heart, especially those who are taking diuretics for reducing the fluid inside the body, then the heat can affect badly, so that they should get a consultation done, titrate their doses of medicines depending on the climate. Otherwise, the heat is not directly affecting the heart. Okay. Any other questions? Thank you. Thank you. Thank you. Vishal Cage. Irfan. I'm having chest pain for the last 2 days. What are the major symptoms that suggest I might suffer a heart attack? That's a good question. Uh, People should know the signs and symptoms of heart attack, but sometimes it is counterproductive because if I'm telling the symptoms, some people with suspicions, their mind is not strong, they will feel that they have the same symptoms. Then they will end up in cardiac neurosis, means they are feeling that they are having heart attack and start consulting the doctor once in every week or so, and their peace of mind will be lost. For those who wanted to know, because if I'm not explaining that, they cannot identify the heart attack early, so the treatment become delayed. So the symptoms of heart attack is basically told, the name is called angina. Angina is a discomfort in the central part of the chest. Sometimes it will radiate into the neck or jaw, and sometimes in the left and the right shoulders, sometimes also to the back. It's not a pain, it's kind of burning sensation, a kind of stricture kind of feeling, something kept on chest feeling, and it will be difficult to explain feeling, and that is called angina. So this is the classic symptom of heart attack, and the angina can be associated with sweating. May not be sweating, may not be there. Sometimes people will have a feeling to go to the toilet. Sometimes they don't have. So all those associated symptoms are not necessary to diagnose a heart attack. And if you feel that you are having angina, it's better to go and consult a doctor immediately, not in the next morning. Immediately go and consult an emergency department. And angina will not come for a 1 minute or 2 minutes. It will be there for at least 5 minutes. So if the pain is or discomfort is not relieved by 5 minutes, then only you should go to the hospital, especially if you are having a risk factor for a heart attack. So with that, I'm stopping. Hope this information was useful. Um, and Assalamu alaikum, Islam. So many comments are coming. Thank you so much. Thank you, thank you, thank you. So this information should be there in the community, so that we can reduce the level of heart attack and to improve the health of the society. Thank you very much.